Hi, my name is Bobby Demar. I'm a physical therapist at Baylor Institute of Rehabilitation in Dallas, Texas. My goal is to guide people through the rehabilitation process. I've been working with Dr. Martin since 2005, and usually the biggest determining factor of outcomes post-surgery are going to be compliance with the exercises, as Dr. Martin mentioned. Now, in addition, weight bearing or the crutch use is also a key aspect of the post-surgery rehabilitation. As Dr. Martin mentioned, weight bearing with use of the crutches is acceptable. However, avoid weight bearing with rotation through the hip. That can cause some adverse reactions. And mentioning the exercise that Dr. Martin had reviewed, it is important that these flexibility range of motion exercises be performed 2 times a day. However, when getting into the strengthening, the latter part of the rehabilitation process, it is very important that the strengthening part of rehabilitation only be performed 2 times a week. These exercises, when it comes to strengthening, do cause a little bit of soreness to the hip, so it's very important that that soreness subsides before performing the strengthening exercises again. And now there are some other concerns post-rehab that people may have some concerns with. Typically, for the first few weeks after surgery, anterior hip pain become problematic. It is typically normal. However, through the exercises, the symptoms eventually do subside. When it comes to strengthening, people typically have some pain located on the lateral part of the hip, but again, until the strengthening improves, the pain is typical and will subside as the hip gets stronger.